So do I just, hey guys, it's Dr. G.
Hi, everyone. We're just waiting for everyone to join us today. In the meantime, I will go ahead and kind of introduce who we are. So my name is Alex. I am the Director of Content Community here at Paloma Health, where we specialize in
Oh, technical difficulties. They are so fun.
Yeah.
They make it interesting.
Thanks for your patience, guys. I don't know what was going on there. Anyways, starting over. Welcome, everybody, to our July office hours. My name is Alex Ruiz. I am the Director of Content and Community here at Paloma Health, where we specialize in hypothyroidism and Hashimoto's. For those of you that are new to maybe our community, as I mentioned, we specialize in hypothyroidism and Hashimoto's. So we're not just a test kit company. We are a full online medical practice, meaning that providers like Dr. Goggin here today is able to actually treat you, see you, depending on the state where you live, and help you manage and optimize your thyroid care. We also offer, as I mentioned, test kits. We're a medical practice, but we also have an online app, which includes a lot of different functionalities from symptom testing. We can do nutrition, counseling. We have like AIP guides and everything on there, resources. You can kind of like track some of your meals. We have some meal plans in there, some workouts, meditations, yogas, a whole bunch of different resources that can really help from a lifestyle perspective, help optimize your thyroid and just help you feel better. So today, so today we are joining with Dr. Goggin here, and she is going to be spearheading our office hours. So without further ado, Dr. Goggin, why don't you go ahead and introduce yourself to our community, and we'll just jump right into questions.
All right, that sounds great. Thank you so much, Alex. Well, I'm psyched to answer y'all's questions. I see already that you've got some good ones for me, and I'm just excited to be able to share information about how you might be able to better manage your thyroid. And so let's just kick it off. It looks like we got the first one. I'm going to read it for you guys. Okay. I love to swim, sister, but have rarely done so for 30 years because I read that chlorine displaces iodine, which is detrimental to thyroid function. In the summer, I occasionally swim in the outdoor pool and put oil on my skin in the hopes that it will reduce absorption of the chlorine. Okay. So this is really interesting, and I think it's important for so many people in the summer, right? Number one, is it true that swimming should be avoided because the chlorine is detrimental to thyroid function? And so this is something that people talk about. When I looked up in the research, I was not finding clear research that swimming in pools was related to hypothyroidism. Now, we know that chlorine is not good for people, okay? So how would we mitigate it? How would we limit our exposure to chlorine? It's always better if you can swim in non-chlorinated pool. Okay, so that's the first thing. There are ways. I do think the idea of putting some oil on your skin before is a good idea to help protect and limit that soaking in. I also think that you don't want to get totally prunified in the pool, because when you get prunified, that means you're really sucking in more of that water. And you know what I mean when your fingertips get pruny. The other thing that you can do is you can actually spray a vitamin C, ascorbic acid solution on your skin. You can make this at home. I just found this. Let me find this. So 1 teaspoon of vitamin C into 8 ounces of water in a spray bottle, and spray it on your body and your hair after you get out of the pool. Now, this can help minimize, so it's a DIY solution, minimize your exposure, because I want you guys to be able to go have fun, swim. I think that it's a great question, and it's true. Chlorine can interfere with iodine. That's because they have the same charges, and chlorine can sneak in, just like fluoride can sneak in to where the iodine molecule should be in your thyroid hormone. So great point, and I really appreciate it. Okay, so next one. All right, what should I be eating to improve my energy? Oh man, this is the $1 million question, and I think actually we need to turn that one around, because more commonly I see people eating things that interfere with their energy. So the optimal energy diet is going to be a diet or a nutritional style. I hate the word diet, right? You guys too. Where we're going to shop around the outside of the grocery store, right? And that is, clean sources of protein, clean fruits and vegetables, and fiber as being our primary things we eat. The things that will sap your energy: sugar, processed foods, especially if we're dealing with autoimmune issues. Grains can sap our energy. And the things that can give us more energy are things like our healthy fats. Healthy fats are so important. In fact, back when I was young, we were taught not to eat a whole bunch of fats. Now we really need to make sure we're getting good, clean sources like extra virgin olive oil, things like fatty fish, and trying to avoid those things that'll sap your energy. Now, I love a book called The Glucose Revolution, y'all, The Glucose Revolution, because this talks about how what we eat and how can make us crash in the afternoon, and how you can keep that from happening. Okay, so The Glucose Revolution ought to be really helpful. All right, what happens if you don't get your numbers in check with your thyroid? Oh, golly gee. So I remember one time someone came in when I was working as a resident. His face was so swollen. He looked sort of like a puffer fish. He was in heart failure. He had swelling all over his body. He was freezing cold. And he felt bad. and so he had what we call myxedema coma. His heart was going very slow. Everything had slowed down in his body. Now that's total worst case scenario if we don't get your numbers in check. Okay. The other things that you guys probably have experienced are everything: brain fog, infertility, tiredness, achy all over, puffy skin, hair loss. All these things can happen if you're not in balance. I mean, the biggest thing I see is people not being able to lose weight and just being super tired and feeling like sleep is affected. They're not able to, they sleep forever and they still don't wake up, right? Now, if that's you really might benefit from having somebody dive deeper and to check your thyroid hormone. So let's see. Okay, the ideal TSH range for a woman in her 30s, and she gives a weight. So now, guys, in general, TS optimal ranges are a little different than what the answer is for the normal range, right? So normal range is like 0.45 to 4.12. Optimal range for everybody, whether you're thin, heavy, male, female, around 0.5 to 2.5. That's really the sweet spot, in my opinion, where people are feeling as much energy as possible and yet not too much, not overstimulated. Okay, so that's 0.5 to 2.5. Now that's also going to depend on what is the lab. So the reference lab might have something a little different. Okay, next one. Can you please give us a better understanding of the role of iodine in a Hashimoto's patient? i.e., should we avoid supplementation? Now, this is one where in order to make thyroid hormone, you have to have iodine, okay? And that's another thing for the person who's swimming. Being sure that you have adequate iodine so chlorine's not trying to sneak in there and take iodine's spot is important. But too much can cause a problem, and too little. So it's like a Goldilocks hormone, a Goldilocks nutrient. Iodine is something that you want to kind of get in the sweet spot, usually by checking urine values. So, I think that it's a good idea to follow urine iodine to make sure at least once that in your typical nutrition, you're getting enough. Now, long ago, they added it to salt because what happened was they found that people did not have enough in their diet, right? Seafood, seaweed, kelp, those are kind of the places you get iodine or iodized salt or a supplement. And so some of these salt substitutes, don't always have, you just don't know unless you check. So I guess that's the that's the bottom line. You need to check and make sure you have enough, okay? And not too much too, because too much can actually cause a stimulation so you can create more antibodies to your thyroid if you have Hashimoto's, if you have too much iodine. All right, next question. Wow, rapid fire, boom, boom, boom. Okay, I had my thyroid removed in 2007, and I've been on replacement. And then they started to lower your replacement. They started to lower replacement because the person was losing weight. And they took it down, 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 and then the TSH bounded back up. Okay, but the person is not, and they said, oh, well, maybe we need more thyroid hormone. So when the person tried to increase the dose, it started to cause shaking. Okay, now this is a great question. And the first thing I think about is that if you shift doses of thyroid medication a little faster than the person's system likes, your labs can lag behind what's really happening physically, right? And so in this event where you feel like what's happening in your body does not match, and you feel physically like you're having shaking or palpitations or anxiety or starting to have loose stool, which these are all things with too much thyroid replacement, all right? And what are those things again? Things start to run a little fast. Palpitations, your gut starts to run faster. You can have, shaking or tremor, and that can mean that it's time for a complete thyroid check, right, to see what's going on with your levels of free T3, free T4. So probably the thing to do is to check again, see where you are. It might be that now when you recheck, you're going to find that you have a more clear picture of why that's happening, and maybe you actually are hyperthyroid. The other thing is making sure that you're not taking biotin before you have your levels checked. Make sure if you're taking it, that's another important thing, and so that you'll get an accurate read on your thyroid. And some people are super sensitive to little tiny shifts. For people who are really sensitive and can't go from 75 to 88, maybe they're going to need to take a solution, like a oral solution where you can fine tune it and make the dose increase even smaller. So that may be the answer for you. But I think rechecking those labs, full panel, in your back pocket, you can back it down a little bit, but maybe not all the way down to 75. And remember that TSH is going to lag behind in terms of a marker for what's happening in your body. So at least 6 weeks to help you be able to, between times that you're checking that TSH. Unless you're pregnant, then we check it a little more often, okay? But that's a different conversation. We're looking at trends there. But as an aside, hypothyroidism in pregnancy, in early pregnancy especially, needs to be followed really closely. Just suffice to say that usually we'll bump up a little bit because the fetus uses the mom's circulating thyroid hormone, okay? And that's now, that's even in conventional circles. Okay, next question. Do you find lower heart rates with hypothyroidism? Will your resting heart rate increase with better balance of your thyroid? Sometimes. Yes, you can find lower heart rates with hypothyroidism. And if that is causing it, then your heart rate should come up. There are other things that can cause low heart rate. One of them is being fitness. And so it's important that you have someone do a full check of other things, right? You want to have your primary doctor make sure nothing else is going on there, but your heart rate should, if it's low from hypothyroidism, which is a thing, it should come up to more moderate level into normal range, right? As you balance your thyroid. Okay. I have Hashimoto's, and every time my medication is changed, which seems to be every 3 months, it's too high and I have to skip a day, or it's too low and the prescription is changed. Why can't there be a good balance? That is a great question. Why do I have to keep changing my dose? Well, Hashimoto's, it is a little tricky because some of what happens is our thyroid is at times being attacked. And it will be more attacked and not put out as much hormone when we are under stress. It also can change seasonally when we're eating crummy food, all right, which is, we at Paloma, we really consider that those two primary triggers of more problems with Hashimoto's. Supplements can cause triggers. I just saw somebody a couple of days ago and we're like, wow, why did her thyroid antibodies go so high? And it looked like it was related to a supplement she was taking. So it's important to understand that so many things are affecting with Hashi the ability of the thyroid to put out those hormones. Also, it's going to be affected by, do you have iodine? Have you had a bunch of chlorine exposure, right? Like we talked about before. So we've got to have the nutrients, the stress managed. And so I think the biggest thing that can contribute to balance is going to be getting in a rhythm with your self-care routine. Self-care is critical with Hashis, and I know it's a journey because but the other thing, a plug for your self-care is that if you start to do a healthy routine for Hashis, you are doing the routine I would suggest for people to prevent chronic disease and to prevent Alzheimer's and to prevent cardiovascular problems. So doing that lifestyle is going to lead to great rewards. Sometimes it takes time to put the routines into play, but the more routine your schedule is, the less you're going to start to see, and also, your self-care, your schedule, all that stuff, the less we're going to see these big highs and lows of your, needing different strengths. The other thing, guys, it's important to realize many people need a little bit less replacement in the warm months, and they need a little bit, need less in the warm, a little more when it gets cold outside. Y'all notice that? You're like, is this the weather? Yeah, it might be the weather. Okay. So the balance will come. Have faith, keep doing self-care, and it's going to happen. All right. Okay. Just got my test results, and TPO went up 600 plus. Everything else is in the normal range. What else can be done to lower these? I'm gluten-free. I changed my diet. I'm doing yoga. Good job. Way to go. What other tests can be done to see if something is causing this? So when antibodies go up, a few things we think about. One is any new supplements, any new stressors, any new foods. And then it might be, if you're just gluten-free, it might be time to dive a little deeper into a strict AIP style of eating for a while. And I call that an elimination diet. I think Amy, what's her last? Thyroid Connection. That's a pretty good book that can help you get some recipes, some ideas. And the other thing I would say is sometimes we will use, some of us at Paloma, I'm one of them, will use low-dose naltrexone to help modulate the immune system. So low-dose naltrexone is used in a very small dose, titrated slowly, and sometimes it can help sort of cool down the antibody response. But I'm so happy that you've already made all these changes with your nutrition and stress management, going gluten-free. The next step, I think, would be AIP, like in a more intensive way. Reach out to one of our awesome, these dietitians guys at Paloma, they're incredible. They can help you. Like if you're trying to work with some certain part that's hard about AIP, they can help you get there. So, okay. So an ideal reverse T3. Generally, where the normal range for reverse T3, 8 to 25. It depends a little bit on what you are exactly, what's the lab, what lab you're using. But it'd be great to get that under 15. And so in terms of affecting the thyroid, when you're on the lower end of normal, when your reverse T3 is on the lower end of normal, I don't even think about it being low. I only really worry about being too high, because the theory there, and there needs to be more research on it, is that reverse T3 might actually block the effects of thyroid hormone a little bit. So low end, I'm not worried about. High end, we're looking at all the labs to see if we can modulate that down a little bit. Okay. Do I recommend getting off birth control to help hypothyroidism? Well, so now this one, it's important. So if you don't want to, no, in general, my first knee jerk is no. I feel like birth control helps a woman control her life, and that's really, it's totally up to you. But if you aren't wanting to get pregnant and you're sexually active, I feel like some method of birth control is important to allow you the ability to live your life. And so that wouldn't be my first thought. I think that much more effective is getting good nutrition going and getting stress management going, making sure you have root cause. So that is understanding why you have hypothyroidism, and we focus on that. So that's my thought there. All right. How do you know if you have estrogen dominance? Well, there are tests. With estrogen dominance, we think about carrying weight around the lower half of the body, and I think the best answer there, if you have estrogen, if you wonder about it, is to look into some of the hormone testing for that. It's really helpful. What's the relationship between thyroid and gut issues? Okay. So your food tube from your mouth to the bottom, that should be a tube that excludes things you don't want to get in, things that are not nutrients, right? And so when that tube that should not be leaky becomes leaky, what happens is larger molecules can cross into your body. And as they pass into the body's system through the gut, right on the other side of the gut lining, your immune system is waiting to figure out if it's friend or foe coming in to try and protect you, okay? Now, so when bigger molecules get through, your body goes, that's not supposed to be coming through, and we're going to make an antibody to that. And sometimes those larger molecules can look like parts of you, okay? So this is when we start to create antibodies to something that we thought was an enemy, but actually looks kind of like us. So we might have particles come across that are similar to how our joint capsule is, or to our thyroid, and then the body starts to attack it because it thinks that it's a foreign particle, and that's why leaky gut can be such a problem with people. Okay. So we really want to manage leaky gut and get, basically, we want you to be in gut nirvana. We need to be pooping every day, probably a couple times a day. And so if you're not doing that, you're recirculating toxins. And so we really want your tummy to be really good. Okay. How often should you get thyroid blood tests drawn? Okay. Right now, every 3 months, it feels like too long in between. So usually at least, so you have to wait at least 6 weeks, okay? More frequently than that, unless you're pregnant, is not recommended. And so if right now you're working with your provider and it's every 3 months and you feel like, oh gosh, I really would like to know sooner because we're changing things, then any Paloma provider would be willing to check at 6 weeks after a dose change, because that's plenty of time, and then have a follow-up at 2 months. So we're happy to do that. I just have to talk to your provider, reach out to them. I'm sure that they would happily do that. And I feel like it depends. If you're like rolling, everything's good, you don't have symptoms, you can go up to a year between checks. But when we're changing and shifting things and you're not feeling good yet, well, then I would say shorter, and probably follow-ups at 2-month intervals is very reasonable. Okay. Okay, so here you go. The final countdown, the last question. Can you help me understand the correlation between high cholesterol and Hashimoto's? Will my cholesterol go down when my thyroid levels are in optimal ranges? Yes, it will. That's one thing that's pretty well shown in the research in the research that when we have uncontrolled hypothyroidism, it correlates with elevated cholesterol. And when you get your numbers better, you should start to see improvement in your cholesterol numbers too. So that it's a great question. And also, when we see people who are not feeling good on just T4, sometimes they need a little T3, and sometimes adding that T3 can help also with improving cholesterol numbers. So, all right. Well, hey, Alex, thank you so much. You guys, those were incredible questions. I was like rapid
Hi.
fire.
Thanks.
So,
Yeah. Well, thanks guys for joining us today. And thank you everybody for submitting your questions. Again, we are joined today by Dr. Linda Goggin, who is one of our providers at Paloma Health. So you can schedule an appointment with her based on your state and where you're located. In order to do so, you have to become a member. And then once you're a member, you can book an appointment. And you can do all of that either on the mobile app, which is free to download, or just go to our website at palomahealth.com. And you can get started with everything there. But until next time, Dr. Goggin, thank you so much for joining us. And to everyone in our community, if you have any other questions, maybe that we didn't get to, go ahead and feel free to leave them in the community, and we will get back to you with any sort of resources that we have, or some answers from our providers and our clinical staff. And I guess we'll see you in